And while we have been looking at some of the diseases like diabetes, heart diseases, kidney diseases, cancers, and so forth, we recognize that we are looking more at the clinical aspect of it. But many of these things are really lifestyle diseases. And it's really how people are living their lives. So, on a daily basis, if you're eating the wrong things, then you're not going to be healthy.
Those were the remarkable words from the Health Minister, Honorable Dr. Frank Anthony, as he addressed the forum at the launch of the Soka Heart Project on Friday last. The Soka Heart Project is an educational awareness and a fundraising campaign aimed at promoting cardiovascular health in Guyana. It is being undertaken by Strides 592 in collaboration with the Ministry of Health, Georgetown Public Hospital Corporation, and the Caribbean Heart Institute. Speaking at the launch, Minister Anthony noted that many diseases are lifestyle related and as such highlighted the need for more educational programs on nutrition. Following this significant launch, later that day, the Health Minister received a courtesy visit from India's High Commissioner, His Excellency Dr. Amit Tilang, along with his team. They exchanged pleasantries and initiated discussions on areas of mutual interest. To recap the previous day of activities, the Health Minister received a farewell courtesy call from Ms. Yeshim Uruk Kaya, United Nations Resident Coordinator, who commended her for her work service and significant contribution towards healthcare development during her tenure in Guyana. Thereafter, he met with the United Nations Development Program Resident Representative, Mr. Gerardo Noto, to discuss area of mutual interest and opportunities for working together to strengthen Guyana healthcare. Meanwhile, on Saturday, July 20th, several outreaches were done to distribute the eye testing and spectacles vouchers. Not only were residents of Dundee in Region 5 and more in Region 4 and Diamond also in Region 4 able to receive their vouchers, but they were privileged to have on-site testing and start the process of having their spectacles if needed. The Health Minister visited all locations and interacted with several residents who praised the initiative and expressed happiness at the tremendous ease this initiative has brought to their pockets. Following these visits, Dr. Anthony, in the company of Regional Health Officer for Region 4, Dr. Gavinash Prasad, visited the site where the Diamond Regional Hospital is being constructed to spot check works being done as the hospital aims to be commissioned early next year. On July 23rd, the Ministry's Rehabilitation and Disability Services, in collaboration with the Georgetown Hospital Corporation, commenced a 4-day theoretical and practical workshop on occupational therapy in mental health. The training aimed to strengthen and enhance the understanding of the roles of occupational therapists in mental health. Meanwhile, the Health Minister attended the National Judges Forum on HIV, Human Rights and the Law. The forum aimed to encourage reflection among judicial officers in Guyana on the impact of stigma and discrimination on the rights of people living with HIV and key populations. In his remarks, Dr. Anthony noted while stigma and discrimination were particularly prevalent in the 1990s, they continue to exist in various forms today.
The way discrimination is presented against HIV-positive people have gotten a little bit more nuanced, but it's still there. And that is what we need to work to remove from our society. So I think it is important that as judicial officers that you understand some of these things that is happening and work with the programs, the public health programs and other persons who are interested in making the environment more wholesome for people living with HIV and AIDS.
On the following day, Minister Anthony attended a meeting on the digital health strategy. Through this strategy, which is being collaborated with the Ministry of Health and the Tony Blair Institute, aims to enhance healthcare delivery, improve patient outcomes, and streamline health services across the country. During his brief remarks, Dr. Anthony disclosed that the ministry is desirous of establishing a subdivision to manage digital health in the overall public health sector. With this division, it will comprise of telemedicine services, electronic health records, and the management of departmental activities, which includes tracking diseases and managing day-to-day tasks at the head office in Georgetown. Meanwhile, later that day, the health minister attended the launch of the Bachelor's of Science in Respiratory Care program. Speaking at this event, he had this to say.
Having recognized all these challenges during COVID and how ill-prepared we were, this then became a natural thing to do. We just needed to get a course like this so that we can train more professionals and have them in the system.
This has brought us to the end of this week's review. Thank you for always staying tuned and keeping up to date with our weekly initiatives. Until next time, do stay well.